in the hematology part of the physiology practical curriculum, whatever has to be done hands-on by the candidate, whatever are to be performed, obviously not all on the single day of the exam, but whatever experiments are there in the curriculum to be performed by the candidate himself or herself have been covered, except I know that who have joined late, they have not done most of the topics. Mainly who have joined in January itself, they have only done this count of RBC and WBC and nothing else. I know that, but actually thinking from the start of the curriculum here at this institution, this has been covered. For them, we have to find a way out. I think we'll arrange some classes in the coming days. So, and mostly that has to be done outside the normal routine. We are looking into that, but that is for considering the whole batch, it is more or less complete. Okay, count of RBC revision classes are going on. This section is more or less this practical hematology, what has to be done by you, that is more or less complete. Few things except that are there which are to be demonstrated but not done by you. We will see at the last if those can be done, but those does not you don't have to perform those, like platelet counts. Okay, then there are ESR counts, PCV counts. These are maximum what is mentioned that if it is possible, then we will demonstrate it for you. It is mentioned in the syllabus, but whatever you have to do, that has been completed. So, and those who have not done because of joining late, we will arrange for them. That does not mean that whoever wants can join, that part will be for them only, who have joined in January and done only these classes and not attended the other classes. If you were in the course but not attended, that is up to you. So, except, but one thing relevant to that which we will discuss today, these things are RBC indices, because again I have told earlier also that the questions in the hematology lab won't be direct questions like calculate RBC, maybe in case of 1 or 2, but calculate total count of RBC or determine total count of RBC by a suitable experiment, or not like that, or determine total count of WBC. So, most won't be like that. So, you require to learn something for the exam purpose, as well as this is relevant in our clinical scenario. What are RBC indices? Okay, so RBC indices, there are quite a few indices. Indices, first of all, the word index. Indices is the plural form of index. Indices. RBC is for red blood cells, so it is the plural form of index. What is the meaning of index? Index has, again, index has more than one meaning, but where here it means it is a measure of something. Index means measure of something. Index, you know about the index in the book at the end of the book, which is giving the list of the topics mentioned in that book, any textbook, any academic textbook, whatever. So, here index means measure of something. RBC indices means some parameters related to red blood corpuscles. So, RBC indices, and here index means measure of something. So, this is for just understanding the meaning of the word. The clinically relevant indices are, RBC indices are clinical, which are clinically relevant means more used, and for what? For mainly for determining types of anemia and all these things are the parameters about the RBC. Anemia still not discussed in the theory classes, it will be discussed. Mean corpuscular hemoglobin. Hemoglobin, you can spell it as HAE, both spellings are correct nowadays. HEMOGLOBIN or HAEMO. Mean corpuscular hemoglobin, and another word to add to the previous one is concentration. So, mean corpuscular volume, mean corpuscular hemoglobin, and mean corpuscular hemoglobin concentration and I'm afraid that I have to rub it off very quickly because somehow this is not working. If it is not rubbed within a maximum of few minutes, this eraser is not working. It means maybe the ink is such that the erasers we are changing this, but dusters and all, but these are not working. So I have to rub it off quickly. Otherwise, it is getting very difficult to remove. There is some issue. So just there is nothing to note down actually. Everything is in books. Usually these have these terms, the abbreviations of these terms are more or less standard. Okay, MCV, MCH, MCHC. By these terms we do not usually mean anything else, at least in the medical scenario. So, but still I'll suggest as always that whenever in the exam you have to mention something, maybe you are writing a answer to a theory question, at least in the beginning of the answer first mention the full form, write in bracket, and then in the rest of the answer you can use the abbreviation, saying that MCV, MCH, MCHC are more or less accepted terms, accepted. MCV we mean this thing, and I have not come across myself MCV means anything else in our medical curriculum. There are abbreviations like that which itself in the medical curriculum it means multiple things. So always avoid, so the rule is that, or the rule means you follow this thing always, that don't write any abbreviation without mentioning the full form. But still MCV, MCHC, even in questions if you find MCV, MCHC, this means these things, MCV, MCH, MCHC. So what is, and one funny part is that during the exam in the question it is given what is MCV, in the hematology lab also measure, do a relevant experiment and calculate MCV. Now even after doing the experiment correctly, when you will be crossed means you will be asked theoretical questions on the whatever you have done, like total RBC count after you have done, how did you do this procedure, you don't have to write down in the answer sheet, you write down the principal calculation result, procedure you will be asked, will be whatever you have done, what is the composition of Hems fluid, in case of WBC Turk's fluid, what are the functions of the different components, all those things will be asked. Now during that is what I am calling crossing, that is loosely called crossing, that is the viva part of the examination, oral part of that hematology lab, this hematology section in the exam. So whenever the funny part is that asking what is MCV to a student, the answer comes, sir or madam, mean corpuscular volume. So there is nothing, that is just the full form. What is MCV means actually the examiner is asking, in your question it is given MCV, what do you mean by MCV? So the question should be rather like that, the examiner should mention that what is mean corpuscular volume. So what is MCV, you just say the full form, that is not actually the answer. What is MCV, by it is meant that what do you mean by MCV, what is this thing. So mean corpuscular volume, as you can just gather from the term itself, what is the meaning of meaning, again this word mean has different meanings. Okay. Word mean means the context of something, the description of something, that is one mean, but in a mathematical context what does mean means, this is a parameter, mean means average. So 50 students attended yesterday, 40 attending today, 60 attending tomorrow, so the 3 days average is 50 plus 40 plus 60 by 3, that is the arithmetical mean or the arithmetical average. So mean corpuscular volume, here corpuscle means, although it is not mentioned which corpuscle, we are speaking of RBC indices, this is the red blood corpuscle. So there are so many corpuscles, and like we are mentioning from the beginning of our course that in medicine or in physiology relating to the human body, nothing is like that this is 2 plus 2 is 4, 2 plus 3 is 5, not like that. So all RBCs in the body only of the same size, what we know is that it is 7.2 to 7.5 micrometer in diameter, it is theoretical. But what is the volume of a single RBC? So we can't say that all RBCs, as all RBCs are not of the same size. So if we could say what is the total number of RBCs in the body, we can calculate. Well, at least theoretically we can do, like if we take it to be 5 million per microliter, then 1 liter it is 5 into 10 to the power 5 million, yes, that is 5 into 10 to the power 12, 5 million means 5 into 10 to the power 6. So in 1 liter it is 5 into 10 to the power 12. Okay, so if we consider 5 liters of blood, it is like 25 into 10 to the power 12. This figure will come. Okay, so a million times of a 25 million, like this. So billion, trillions, like this. So number of RBCs. So if we could it would be possible that we take the size of these trillions of RBCs and then divide by that number so many trillions. So this is the total size of them, and we could divide by that. This gives us the average volume of one RBC. Obviously, both in theoretical terms, we don't know actually how many RBCs, and practical terms it is not possible. So how it is done? Mean corpuscular volume, because it will indicate actually what mean corpuscular volume will indicate, how these are clinically relevant, whether the size of the RBCs is less, in that why the size is less, why RBCs are not. One important cause of that means size of RBCs being less, that is small RBCs, that is RBCs is not being formed properly, hemoglobin is not being formed. One is nutritional anemia, which will speak about iron deficiency anemia. There is iron deficiency in the body, or nutrition source of iron there is deficiency, so there is deficiency in the formation of hemoglobin, RBC size are less. One cause is that. So these indices indicate some clinically relevant scenario, that's it. So we should know about it, but it is not possible to know the average size of RBCs, or what we can see is if it is possible by staining whether the sizes have increased, if there is any such stain. So, but as these have been just we are discussing this, or these have been become relevant to understand these things, if we can somehow know how are the by simple experiments, if we can understand the volume of one RBC, or that is not a particular RBC but an average volume of the RBCs. So what can be done is that if we can count 10 RBCs and we know the size of all those RBCs, then we can take out the mean corpuscular volume. So instead of going into that how to calculate the volume of the RBCs, is it possible under the microscope? What is to get an idea about the volume of the RBCs, there is a parameter called the PCV, packed cell volume, or the hematocrit. Okay, again packed cell volume or hematocrit it means the same thing. So packed cell volume, I think we have mentioned this term once or twice in the theoretical classes. So packed cell volume is the cellular components of blood. That means corpuscular elements, red blood cell, white blood corpuscle, and platelets. Although platelets strictly are not cells, they are cell fragments from larger, which are the cells, the larger entities called megakaryocytes. But platelets, just loosely saying platelets, RBC, WBC's platelets, these together constitute 50 to 60% of the blood volume, right? This we have mentioned, 55% is, I am wrong, 50 to 60% is plasma, that is 55% is plasma, 45%, but there should not be an exact figure, it should be a range. So 50 to 60% is plasma, rest are the blood cells. So for the sake of calculation, we will take a certain figure, but say this is like 38 to 48% is PCV. That means the volume of all the cells in the blood. So if this is 5 liter of blood, if this is 6 liter of blood, almost like 40 to 45% will be, 38 to 48%, 40-45% will be cells, and the rest is plasma. So if we can, what can we do is that if we just say consider just 1 ml of blood, or even 1 microliter. So if we take a say figure 45%, just for the understanding. So what is the volume of blood cells? This is in 1 microliter. If it is 1 milliliter, it is it will be 0.45 milliliter. Try to understand things simply, otherwise you will get again confused during the exam. In the exam, at least for the exam part, there are so lot of things to just perform on the day. So whatever looks actually simple, you will get confused on the day of the exam. So try to at least learn as simply as possible. See, in 1 microliter it will be this 45%. If the figure was 100, it would be better to that means to just think it over in the mind that 100 ml, so it's 45 ml. So if it's 1 liter of blood is 0.45, it is 5 liter of blood, then 5 into 0.45. Taking it to be 45%, so it will be mentioned whether it is 45. So PCV can be determined by hematological experiments, and that can be determined at the laboratory. So if we know the PCV, we know the volume of all the cells, RBCs, WBCs plus platelets together. If we know the PCV, if it is done as an experiment in the lab, so PCV means the volume of all the cells. Okay, so if 100 milliliter blood I have taken, now by the experimental determination, this is the PCV. Say it is 40, so that is 40 ml. So that is 100 milliliter, but we don't need to take 100 milliliter. We need to take, like in experiments, we take few drops or 1 or 2 drops. Few drops we do like that. So the PCV can be calculated by calculated or by using instruments, obviously, which are designed for measuring that. So that is how we know the volume of the cells. Now, for knowing the volume of the size of the RBC, again we repeat what we need to know: volume of RBCs and the volume total volume of the RBCs and the number of RBCs. For the size of 1 RBC or the volume of 1 RBC, volume of X RBCs, and what is that X? That is what we need to know. So for that, as it is not possible for these 5 liter of blood together, we take what is not relevant but not needed in the calculation, that how much volume is taken. In 100 ml of blood, if we take 100 ml of blood, what is there to laugh? Why are you laughing? Is there anything to laugh? In 100 ml of blood, if it is 45 milliliter of cells, if we can know that volume of RBCs and we know in 100 ml of blood how many RBCs are there, then we can calculate. Now, do you know by now in 100 ml of blood how many RBCs? Can we do it experimentally? Can you do it? Yes or no? Whose answer is yes, whose answer is no? Yes, how many? In 100 ml of blood, how many RBCs are there? Can we do it experimentally? Whatever we have learned now? So your answer is no. So how many are with him? So he is saying we can't calculate, we can't do it experimentally, that how many RBCs are there in 100 ml of RBC. How many are with him means how many are for no? Just raise your hand. How to perform PCV, or before that I have to say a few more words. You still don't know how to perform PCV. Actually, what those few more words are, as WBCs and platelets are comparatively much lesser in number compared to, not smaller. Smaller is the wrong word here. Lesser. Smaller means high. Lesser in, we are speaking of numbers. WBCs and platelets are much lesser than that of RBCs. For practical purposes, we take the PCV and the RBC volume to be the same. That means in 100 ml of blood, if we have a value of PCV as 45, we take, there are 45 milliliter of RBCs. If we 1 liter of blood, we take it to be 0.45 liter of RBCs. Actually, it is RBCs plus WBCs plus platelets. Maybe if there are other abnormal cells, they also, but those will be in most cases it will be, or almost all cases it will be, RBCs will be much more in number. RBC is thousands times more than WBC. So, or for all practical purposes, we take the PCV to be the RBC volume. Actually, it is RBC, all the cellular components taken together, just except the liquid, this plasma portion. So, in 100 ml of blood, there are, if we take the value to be 45, then it is 45 milliliter of RBCs, although strictly speaking, it is not RBCs. We are considering for the calculation. Because PCV is not to be done by you from the exam point of view, you are not to perform the PCV experiment, that will be given in the question. PCV is this. So, if you just know the RBC count in 100 milliliter, then it will be sufficient for you to calculate the MCV. Now, just for the sake of calculation, you have to do it experimentally, but for the sake of calculation, showing the calculation right at this moment, we take, say, this is the volume, number of RBCs in 1 microliter of blood. So, if these two are known, so in 1 microliter of blood there is 5 into 10 to the power 6 volume of RBCs, number of RBCs. Now, what is the volume of RBCs? Is 0.1 microliter of blood volume. We wrote just now. 1 microliter of blood, what is the volume? That is the PCV, 45 per. So, if we take 100 milliliter, it is 45 ml. If it is 1 microliter, it is 0.45 microliter. So, this 0.45 microliter volume of, we have to write it, just simple unitary method which you have learnt in maybe standard 3 level, standard 4. 5 into 10 to the power 6 RBCs, the total volume of them is 0.45 microliter. Volume of this number of RBCs is this, the volume of this number of RBCs is this. This is clear. Clear means it should be clear that in 1 microliter of blood contains so many RBCs and the volume of those RBCs taken together is 0.45. Although strictly speaking it is RBCs plus WBCs plus platelets, but for practical purpose RBCs are much more in number, so we consider it to be the same volume. If you say okay, I will reduce a bit of it, it is 0.43, 0.42, it will become something. Just for calculating, showing the calculating one, so we are taking it to be, and it won't match like this, it won't be 45 always, it can be given any figure. It won't be 5 into 10 to the power 6, it may be 5.8, it may be 5.7, whatever will be calculated. So, now this, so volume of 1 RBC is this. So, logically if you just leave it at here, this is logically the correct answer. And as you don't have calculators, you can't use from the, again for the examination purpose I am telling you, can't use mobiles or calculators. If calculations are such that it is very difficult to calculate in the mind, then this answer will suffice, okay. This answer will suffice, although if we have to calculate, if there are such figures which can be calculated till the end, it is better you calculate up to the end, and for that I will suggest don't use fractions, because using fractions sometimes it becomes, there will be so many fractions as I told you in RBC counting and all. Don't use fractions, don't use decimals, use fractions, fraction forms, don't use decimal forms. So, if you get a figure like 45, instead of writing 0.45, you write it as 45 by 100, and 45 by 100 by 5 into 10 to the power 6 is, it is C, it will be coming like this, this will be 10 to the power minus 2, yes, this will be like this, and this will be in microliter. So, this is the answer. So, this is MCV, okay. So, the MCV in this case, it is 9 into 10 to the power minus 8 microliter. Now, if you leave the answer here, it is logically correct, but the theoretically again accepted unit of MCV, measuring MCV, so that it becomes a convenient figure. 9, not that 9 into 10 to the power minus 8 is mathematically wrong figure, but to make it a convenient figure, the theoretically accepted unit of MCV is femtoliters, femto, FEMTO, femtoliters. and 1 femtoliter is 10 to the power minus 15 liters. Okay. Now what we have got is 9 into 10 to the power minus 8 microliter, and I have not memorized anything, we will just convert it. Okay. So this is correct for conversion of microliter to liter. So 8 and 6 is 14, and that is plus 15, that is minus 14 and plus 15 by the law of addition of exponents. That means how to multiply, law of multiplication of exponents, we add these figures up, minus 8 plus minus 6 plus 15, so that is 10. (90 femtoliters), and again we all have theoretical values, and we are calculating it when we are doing it in the laboratory, we are calculating it experimentally. The theoretically accepted range, it can't be a certain, so PCV can be less than 45, RBC counts can be more or less than 40, whatever we do it in the lab. PCV you don't have to do yourself, RBC you have to do yourself. So the theoretically the range which we speak about, that it is normal, outside that range it is considered abnormal, like in most parameters. Pulse rate 60 to 100 is considered normal. So it's not like answering whatever we spoke of in the clinical classes, it's not like answering what is the normal pulse rate, 72, no, that is basic, that means for the beginners we call it as at the school level, that 72 per minute. So answer is 60 to 100 per minute, like that. MCV is 78 to 92, this is the accepted value. 78 to 92 femtoliters is the accepted value, this is the range in which femtoliters, this is normal. If it is say 70, then it is somewhat less, if it is 100, it is somewhat more, if it is 110, it is still more, like this. So this is how to calculate the MCV. You have to, from your exam in the hematology, what will be given? PCV will be given in the question, because PCV you are not to do yourselves. This is the PCV or hematocrit, packed cell volume, and do a relevant experiment and calculate MCV. This will be the question. So you have to do total count of RBC by this, using this Hems fluid and all, whatever value you get, and now always it won't be 45 and 9, it may be 42 and your value is say 5.7, 4.9. So if it is such that you can't go to the last step, you just convert whatever you have got in microliter into femtoliters. Just show that at least this is microliter, so it is into 10 to the power minus 6 liter into 10 to the power minus 15, 10 to the power 15 femtoliters. So those 10 to the powers exponents you just add up and leave it at that. So it may be like this, it is 42 by 5.7 into 10, right, femtoliters, and this is what is, if you use the formula, MCV, not PCV. There is a formula written like this, MCV in femtoliters. In the books it is written, it is PCV by RBC count in millions into 10 in femtoliters. Now this is the formula written in books as well. Now you can, in the objective structured questions, if it is in the exam, I am not talking about the hematology lab, objective structured questions, you can use this formula, that is not wrong. You will be given 2 minutes say for one objective structured question. The timer will be there, so 2 minutes. So you can just put PCV, what is PCV value will be given 45. In the objective structured questions, RBC count is also given. It is saying it is 3.7 million. So you put 3.7 over there and you write 10 femtoliters and leave it at there, you will get full credit. But I will I would suggest don't go for the formula, but whatever we have done by the just shown by the unitary method, do like that. Why? If you say the commonest mistake is, what students do is PCV, they write, okay, it is still 45%. So say 45 or 42, whatever is given, they write it like this, 42%. RBC count is given 3.7 million, or in the question it also may be given 3.7 into 10 to the power 6, or it is 3.7 million. So what students do is they write this, multiply it by 10, and then what they do is it is 42 by 100. 42% means by 100, 3.7 into 10 to the power 6 into 10, and then what happens is it's after 42 by 3.7, this is becoming actually 10 to the power minus 7, I think, and the answer becomes wrong. Answer becomes wrong. It will be 42 by 3.7 into 10. So why it becomes wrong? Because in the exam, in the question it is given percentage. By mistake, the percentage is written over here, 10 to the power 6 is written instead of million. So if you use the formula directly by memorizing that this is the formula, I will just put it and get my answer, then you have to remember that percentage you cannot put, you have to put only the figure. If you have to put it here, you can't put that 10 to the power 6. You have to put whatever is the figure in millions, that before millions the figure, that figure, then it will be according to the formula, it is correct. PCV without the percentage, writing the percentage, if you write the percentage, it becomes by 100. 10% means 10 by 100, 20% means 20 by 100. So I will rather suggest in 2 minutes it is possible to do the unitary method. Once you have the concept, it is possible that 45, it is given 42%. That means 1 microliter of blood contains 42 by 100 microliter of RBCs. In bracket you may write, just in short, if you don't have time, you don't have to write 42 by 100 RBCs. Strictly speaking, it is all cells, but for practical purposes, we consider to be RBCs only. It is 42 by 100 microliter of RBCs. The number of RBCs is given, it's 5 million. There you write, it is 5 into 10 to the, or 3.7 million means it is 3.7 into 10 to the power 6. So 3.7 into 10 to the power 6 RBCs measure 42 by 100 microliter. So 1 RBC measures, or volume of 1 RBC, volume of so many RBCs is 6, volume of 1 RBC. Then you will find it correct and you will not make mistakes. You will just do mathematical calculation, just add up the exponents or something. 42 by 3.7, if it is not possible, you leave it like that, 42 by 3.7 into, and it will come into 10 after the converting microliter to femtoliters. But if you want to do like this, then you have to be very careful, don't put the percentage and 10 to the power 6. So my suggestion is always do by the unitary method, because in 2 minutes that calculation is possible. Even if not the final calculation, that writing the steps of the thing, the whole thing. So we have discussed it over say 15-20 minutes, but it is possible to just write 2-3 lines and get the answer. If you go to put the formula, these mistakes, we are always seeing 50-60% students, at least 30% students are making mistakes during the exam. By going to put the formula, they are putting the percentage and that 10 to the power 6 and it is becoming wrong. But they are writing in femtoliter. In femtoliters, you have to put that without the percentage part and without the 10 to the power 6 part. Okay. So this is mean corpuscular, about mean corpuscular volume. Now what does mean corpuscular hemoglobin mean? Mean corpuscular hemoglobin means amount of hemoglobin contained in 1 RBC. Before that, I could just mention, if instead of 1 microliter of blood, if you take any volume of blood that is not, that means relevant, but that does not change the logic. If you take 100 ml of blood, yes, it can be done. So in 100 ml of blood there is 42 ml of RBCs, or if the PCV is given, it is 45 ml of RBCs. So it is 5 million per microliter, so you convert it to 100 ml. If the number of RBCs you calculate it is 5 million, or it is given in the question 5 million per microliter, or you calculate in the lab, in 1 microliter it is 5 into 10 to the power 6. So in 1 ml it is 5 into 10 to the power 9 for microliter to ml. In 100 ml it is 5 into 10 to the power 9 into 100 it is 5 into 10 to the power 11, and again 45 by 5 into 10 to the power 11, and that time the unit will be ml. In 100 ml of blood there is so many RBCs, there are so many, this is the volume of RBCs, it will again come the same, 9 into 10 to the power minus 11 ml. So it is 9 into 10 to the power minus 11 into minus 10 to the power minus 3 liter. So converting into femtoliters, minus 11 minus 3 minus 14 into 15, it will become 90 femtoliters. So whatever you do, just if the conversion factor ml to microliter to ml, that if that conversion factor is right, you get the answer, and it is simpler. Avoiding mistakes is to avoid mistakes, it is better to do by the unitary method. In case of hemoglobin, now hemoglobin, do you know how to measure amount of hemoglobin in the laboratory? No. Answer is no or yes. You have not done. Salicylic acid hematite method you have not done. So you know. So we take a figure, MCH is amount of hemoglobin in one single RBC. Now we have to do it in the lab, but what is the amount of hemoglobin in blood? Around 12, yes, 12 to 16, 14 to 18 for males, 12 to 16, or sorry, 14 to 16 gram per 100 ml in males per DL. DL means 100 ml. So this is 100 ml. So while calculating amount of hemoglobin in one RBC, so amount of hemoglobin in 100 ml of blood is 15 gram. We are taking 15. It may be 12. It may be 13. Whatever is given. And amount of number of RBCs in 100 ml is, if it is 1 microliter is this, then 1 microliter of blood contains 5 into 10 to the power 6 RBCs. 1 milliliter contains 5 into 10 to the power 6 into 10 to the power 3, because 1 ml equals to, these conversions are easy conversions. Liter, kiloliter, liter, these conversions, centiliter, milliliter, microliter, these are easy conversions. So milliliter, microliter to milliliter is 10 to the power cube. So many RBCs. So 100 ml contents into this into 100. That is 100 is 10 to the power 2. So it is 6 plus 3 plus 2 is 5 into 10 to the power 11 RBCs. So 100 ml of blood contains 5 into 10 to the power 11 RBCs, and 100 ml of blood contains 15 gram of hemoglobin. So that's it. 5 into 10 to the power 6 RBCs. Hemoglobin is contained in RBCs. Hemoglobin is not contained in anything else than the other parts of blood are the RBCs. So in these number of RBCs, quantum of hemoglobin, sorry, not milliliter, number. This is not a volume, this is a number. In 5 into 10 to the power 6 number of RBCs, hemoglobin content in 15 gram. So in each RBC or in one RBC, 10 to the power 11, sorry, 5 into 10 to the power 11 is. So I am not memorizing anything. This is what is the answer. Okay. As 15 and 5 are easy to calculate, this is 3 into 10 to the power minus 11 gram. Now again, for the figure to look convenient, the unit used is picograms. Picograms. PG is the short form, PICOGRAMS. Picograms, and the conversion is 1 gram is 10 to the power 12 picograms. So 3 into 10 to the power minus 11 gram is 10 to the, by multiplying it by 10 to the power 12, it is picogram. It comes to minus 11 and 12 is 3 into 10. That means plus 1, that is 10, right? It is 30 picograms. Accepted unit of whatever the used unit of MCH is picograms. It is 1 gram is 10 to the power 12 picograms. So it is 30 picograms. Again, theoretically accepted range is 27 to 32 picograms. 27 to 32 is the theoretically accepted range. If it is say 36 picograms, if it is 22 picograms, this is less than this is outside the normal range. So again, this is easy if we know. And now in case of laboratory during the exam, what can be given? You know how to estimate hemoglobin by the Sahalis acid hematine method. You know how to estimate RBCs by using this Hems fluid by the hemocytometry. So any one of them will be given in the exam. It will not be such that you have to, in that 45 minutes you have to do both hemoglobin and RBC. Any one will be given, other you have to do and calculate MCH. If it is given total count of RBC is this, calculate MCH, you have to do the Sahalis acid hematine method, take out hemoglobin and calculate MCH. If it is given hemoglobin is this, you have to use the Hems fluid and do RBC counts and take out, calculate MCH. This is from the exam point of view. Again, there is a formula, but I would suggest don't go by formula, that is, then again you will miss mistakes. The formula for MCH in picograms is hemoglobin count by RBC count in millions into 10 picograms. But again, what is the mistake? Hemoglobin, usually there is no mistake. If it is given in the question as say, again, instead of 15 it's 13, it's 13 you put. Here if it is given say 4.7 you put it, but the commonest mistake is you put this. If you put this 10 to the power 6, it becomes wrong. So you have to remember, if you do it by memorizing formula, then you have to write 13 by 4.7 into 10. Again, in 2 minutes it is better to do by the unitary method. You just get the question, you just see what is relevant. Now sometimes questions will confuse you like this. Instead of only the RBC count and the hemoglobin count, there are a lot of counts given, the total count of WBC and all. So you have to think it in your mind, those are irrelevant to that question. You just pick out, okay, I have been given to calculate MCH, so I will need hemoglobin and RBC. You see those two figures, do the unitary method quickly. If it is 13 and 4.7, you just leave it at 13 by 4.7 into, ultimately it will come, the result will come 13 by 4.7 into 10 picogram. But you try to reach it by the unitary method, that is my suggestion. If you go by the formula, it is not actually wrong, but there is a chance that by mistake you would put that 10 to the power 6, then it is wrong. Then actually it becomes wrong. MCHC, mean corpuscular hemoglobin concentration, is, this means that, what is this means? That is the hemoglobin, it is not taking into consideration the RBC count, it is the hemoglobin, amount of hemoglobin in unit volume of RBCs. It is considering the RBC volume and not the RBC count. Okay. So in 100 ml of blood, we know it is 15 gram of RBCs, but it is MCHC is the hemoglobin concentration in by, that means there are other parameters, weight by volume we take. There are so many other parameters in this physical world, this physics. This weight by volume, considering the volume of RBCs and not the count. That means the hemoglobin concentration as a volume of RBCs. If the volume of RBCs is say 50 ml of RBCs, not 50 ml of blood, it is 50 ml of RBCs, what is the amount of hemoglobin is that? And that is very easy, because if we know PCV, 100 ml of blood, there is 45 ml of RBCs, although strictly speaking it is WBCs plus platelets, but practical terms we consider 45 ml, and 100 ml of blood, there is 15 gram of hemoglobin. So it's 15 by hemoglobin into, why this 100? It is as the percentage of volume of RBCs, amount of hemoglobin, or the weight, amount means weight, mass or weight, amount of hemoglobin taken as a percentage of the volume of RBCs, not volume of blood. So as the volume of blood is 100 ml, the volume of RBCs in that amount of blood is 45 ml. Considering RBCs are much more greater in number than WBCs and platelets, that PCV gives me the figure. So if it is 15 and 45, it is easy, 1 by 3 into 100, it is 33.33, it will be recurring. 33, that is into, after doing 100 instead of writing, it is 33.33%. Okay. But obviously it won't be exactly 15, it can be 14.2 and the PCB may be given as 44.7. So it is 14.2 by 44.7 into 100. That is the in percentage. But again, from the hematology lab, what we will get, PCV you won't have to calculate by doing experiment on your own. So PCV will be given, hemoglobin you have to do by the Sahali's acid hematine method and calculate the MCHC. In case of OSPI, this objective structured questions, it will be easier, I think, in this case. It is not actually a formula, but you just put the hemoglobin count in 100 ml of blood, the PCV is 45. So hemoglobin by PCV into 100, whatever figure you get, that is the percentage. If it is not possible to exactly calculate, like say 13.8 by 46.2, so you leave it at that, into 100, this percentage. So that is the percentage. MCHC is the most clinically relevant, although I will try to again discuss it during the theoretical class of on anemia, but if we don't have much enough time, then for that, MCHC is the most clinically relevant or most clinically useful, because it does not take into consideration the number of RBCs. The number of RBCs is not considered here. It is clinically most useful parameter to indicate anemia. I think we should discuss these things after discussing anemia. It is the RBC count is not relevant here. It is actually according to the, it is per volume of these RBCs. MCHC is theoretically accepted value again is 32 to 38%, and there is a reasoning that MCHC can be less. That means hemoglobin as a volume of RBCs can be less. Say it is instead of 32, in a laboratory report it comes out to be 28 or 29, that is possible, but it can't be more. Can't be more means can't it be 39? So nothing is exact in science like that. But usually means never it would be like 45, 46 or 50. The reason for that is that hemoglobin machinery, hemoglobin synthesizing machinery of the capacity of the human body cannot exceed a certain limit. So in a certain volume of blood or in a certain volume of RBCs, hemoglobin can be less, as the hemoglobin is not being synthesized properly due to some purpose. But hemoglobin synthesizing machinery has this, what you are calling it, a machinery, that is all these protoporphyrin rings, iron, these combine, heme is formed, globin is formed. There is a certain, the body cannot exceed the normal capacity to synthesize hemoglobin. There is a certain capacity that is saturated. So as hemoglobin can't be synthesized much more, why can MCH be less? Because probably in iron, like in iron deficiency, but or any other cause. So hemoglobin is becoming less, RBC counts are also becoming less, RBCs are not being formed properly. Iron deficiency is probably not the correct example to give here. There are diseases where hemoglobin synthesis and RBC counts both decrease. So MCH may be proportionally, MCH may be again coming, as it depends on the RBC count. But the volume of blood, so the RBC's number of RBCs in that volume of blood, so if it is 100 ml, it is 45 ml or 42 ml, whatever, 41 ml. So instead, hemoglobin synthesizing machinery, RBC are forming less, but hemoglobin is being formed more. Hemoglobin can't be formed in the plasma. So that is being done somewhat. I don't know whether proportion will be the right word here, but it is, you write it like this or you express it like this, it has a certain capacity that can't go above a certain limit. So MCHC cannot become 50. It can be less, but it cannot be more. So maybe we will discuss this again in the theoretical class during our discussion on anemia, but this is what. So MCHC is important, clinically more relevant, and it cannot exceed a certain limit. This can be given as reasoning type of questions in the exam as well. So with that MCV, there are something others called the color index and all. I think not much, at least from the exam point of view. So MCV, MCH, MCHC clinically useful. RBC indices which you have to calculate in the lab. Whatever, for MCH, any of hemoglobin and RBC will be given, you have to calculate the other in the lab and express your result. For MCV and MCHC, PCV will be given. For MCV, you have to calculate the total count of RBCs. For MCHC, you have to calculate the hemoglobin by the Shahli's method, Shahli's acid hematine method, that is. You should call, express the full name, Shahli's acid hematine method. So, if the question is on MCV, MCH or MCHC, now you can tackle. PCV will be given. PCV you will not need to do on your own. At least I can say about the first Prof University exam. PCV will be given wherever it is needed. You have to do the other parameter. In case of MCH, either of a hemoglobin can be given. So, you have to do RBC on your own. RBCs can be given. You have to do hemoglobin on your own. Actually, it can be so. If we provide you 2 hours, you can do both and do, but that will not be in the exam. Any one will be given other, and again other not required parameters may be given in the question, say total WBC count and all. So, just you have to remember that those are not needed for the answering this question. So, this is a blood report of a certain lab report of a certain person, except the RBCs it is not given. So, can you calculate the MCH? So, RBC you have to do on your own. So, but WBC counts or whatever the differential counts are given in the question, that is not relevant to answer that question, if those are given. Okay, for today I think not much time is left, not much means it's already 12:20, but still you will practice total count of RBC now as you are doing. So, maybe this is the last week we are doing this hematology practice. Next week we may be passing on to some other topic, clinical topic, or let's see what we do. So, this week again has a holiday, academic holiday on 23rd, that is A group will miss the physiology practical. Anyway, this is the probably the last week we are doing this hematology, at least before the first internal assessment. We may revise later. So, you do total count of RBC, practice it and think it in your own mind that say PCV is given, total count of RBC you do, say what is possible to calculate from this MCV. So, do that. Okay. Say hemoglobin is given, total count of RBC is due. Today after doing total count of RBC you write what is MCV, what is MCH, right. From that count, whatever count you get, okay, you take a hemoglobin say 15 gram per deciliter of blood, PCV say 45%. So, you calculate the MCV and MCH today itself after the getting the count, measuring the count. Green, wearing the green. So, your name is Orithro Mondol. So, today আঁখি আজকে ওদের রোল নাম্বারগুলো নিয়ে নেবে, হ্যাঁ ওই যে যারা নতুন আমি হ্যাঁ what is you have to keep at least you have to read one textbook, no, like for the topics. I have the and so like I have like prep also from Manas's notes. So like yes, you have to prepare from some textbook. That is, this is a professional course. There will be no particular textbook. You can follow any textbook. Here, that book is mostly followed. That book by Dr. Pramani. So, but you have to read the topics from, study the topics from some book.
So, along with that, do we need to go for the internals also past years?
Internal
exam of past years.
No, not internal exams. I think you look at the previous year's university question papers, not the internal exams. So, there are so many colleges, so many internal exams. All questions may help you, but it is better to look at the previous year's question papers and this year question paper, which has this year means October, November 2005. This prof, this has some changed format and all. But even if with the previous format, the questions, some questions will be, the topics, the questions will be similar, almost similar, but the pattern has changed. So, internal exams, I think it won't be possible. So, there are so many colleges, so many internal exams, and how will you procure those, or how will you get hold of those? So, maybe you get from your seniors the maximum the internal assessment questions of this college.
Yes.
So, better to look at university question papers, okay, and see which topics. University question papers will obviously will cover, the questions will be from all topics. So, you have to see which are from hematology, which is from GI, whatever you have studied till now, and look at those questions. Okay, we will try to, although this is a 50-mark question paper for this exam. So, the questions will be said that there will be a particular format. There is no actually prescribed format for the internal assessment. So, it will be according to the department's HOD, departmental HODs. But in the finals, now I think it won't change for, at least for your batch, it won't change this year, this year's exam, it won't change. It may change later again. just look at for the format, how many 6 marks question are there, they have added this reasoning type of questionnaires. There is no specific technique to follow for Viva and OSPE. Whatever is being discussed, you as a, in theory, practical. So this is if so. Say you are asked to in a OSPE, there may be a picture of an instrument given. Identify the instrument, mention its use. This is the OSPE. So you say you have a RBC pipette. So you have to identify and write the use. So not only theory, whatever we are learning, that will be formed an objective structured question for say 1 mark, and for answering those types of question, usually the timer is set 1 minute. For answering these questions, mathematical calculations, timer is set 2 minutes. That's it. There is nothing that I will study something extra for OSPE. Same things, questions, the question pattern is getting changed.